Morning, everybody. So welcome to today's Art and Culture webinar that we have Manitharan. So the topic for today is one of the topics close to my heart, I would say, and has a big impact personally, I feel, and professionally as well. So the topic for today is dance and mental health. And first of all, I would like to welcome our president of the West Zone, Dr. Bhavi sir. Let me just share my screen first. Yes. So I would like to welcome our president, Dr. Sudhir Bhavi sir. He, as most of you all already know, is a professor and head of Department of Psychiatry at NKP Salve Institute of Medical Sciences, Nagpur, with 37 years plus clinical experience. And he is our president of IPS West Zone. He has also got the Lifetime Achievement Award by the Bombay Psychiatry Society in 2022. So these are one of the many awards he has received. And he's also edited the first book in the world on cyber psychiatry for the Indian Psychiatry Society in 2021, and he's part of various journals and books. He's also an acclaimed light music vocalist and has cut an album of his songs in 2010. Due to unavoidable circumstance, and he has another lecture, hence he will not be able to join right away. But let us continue with our next agenda. Yes, so to introduce next is our chairperson of Manitharang, the main person behind the idea that we have for the whole webinar series, Dr. Darpan Kaur. She is a professor of psychiatry, Department of Psychiatry at Mahatma Gandhi Mission Medical College and Hospital, Navi, Mumbai. She's also the founder and consultant psychiatrist at Sadhguru Mind Care, Mumbai, as well as V Mind, Mumbai. She is our chairperson of the Art and Culture Subcommittee, Indian Psychiatric Society West Zonal Branch. And she's won many awards. She's a trained Shamak Davar Institute of Performing Arts. She's a trained dancer. She's also won awards for Best Dancer, Solo Dance, as well as Group Dance. And she's also choreographed the award-winning dance performance. So without further ado, I welcome you, Dr. Darpan, along with all the psychiatrists present today. Over to you, Dr. Darpan.
Thank you very much, Dr. Lisa Barros Mascarenas. And it's wonderful that we're doing our fourth webinar as part of Manitharang webinar series on dance and mental health. And I'm very happy that, we could put this whole program together. And Dr. Lisa has done a great job as a member of the Art and Culture Subcommittee. And she's a dancer herself and a consultant psychiatrist from Goa. So together we have coordinated and planned today's program, and I'm happy to chair this session. And the topic today for our Manitharang webinar series is dance and mental health. And we have a great panel of psychiatrists who will be speaking on dance and mental health. And we also have three exciting performances. So Dr. Lisa, can you show the first slide of the Manitharang? First slide. Yes. So as I introduce this topic as the chairperson, the Psychiatric Society of Western Zone, IPS West Zone, has an art and cultural subcommittee which presents monthly psychoeducative webinar series on art, culture, creativity, psychiatry, and mental health. And we've titled it as Man E Tarang. And every month we have some fascinating aspect of art, culture, creativity, and its relevance with psychiatry and mental health discussed by esteemed panel of psychiatrists. And so far, the first one has been on poetry and mental health, and then we've had storytelling and mental health. Last month, we had music and mental health, and this month, we have it on dance and mental health. So over to the next slide. Today's session, I'm already introduced as the chair, and Dr. Lisa B. Mascarenhas is the moderator. Dr. Sudhir Bhave sir will be joining us shortly midway, as he couldn't join today due to some personal reason, but he will be joining the program and giving his precedence welcome to all the speakers and psychiatrists who are performing. And finally, the vote of thanks will be given by our convener, Dr. Alkesh Patil. So today we have three esteemed psychiatrists, Dr. Anita Sukhwani, who is a consultant psychiatrist from Mumbai, Dr. Akshata Amonkar, consultant psychiatrist from Panaji, Goa, Dr. Ankit Panchmatia, who is a consultant psychiatrist from Ahmedabad, Gujarat. They shall be speaking and talking about dance and mental health. And we also have three psychiatrists who shall be, they have shared their videos and their performances will be played, and they shall be joining live and shall be putting insights on their journey as a psychiatrist and their passion for dance. So we have also Dr. Abhijit Pai, the Honorary Secretary of IPS Western Zone Branch. His performance will also be shared, and he shall be joining our webinar soon. We also have Dr. Tanvi Pednekar, who's a consultant psychiatrist from Mapusa, Goa, and Dr. Charmi Shah is a consultant psychiatrist from Ahmedabad, Gujarat. So as you can see that the IPS Western Zone in its true sense from Goa, Gujarat and Maharashtra, we have the panel of psychiatrists who are speaking and their dance performance and very well represented in our committee as well. Over to the next slide. So the overall program outline for today is that the welcome address, then I've completed my introduction now, and we've introduced the speakers to you and the dance performances. The dance performances are also titled in their own unique way. Dr. Abhijit Pai's performance is titled Step by Step Create Magic. Dr. Tanvi Pernikar's performance is titled Dance to Your Own Beat, and Dr. Charmi Shah's performance is titled Beat the Blues with the Moves. So it's a great program, and it's like a first of its kind when we are aiming to combine scientific aspects of creativity and mental health, and also correlating and following it with performances. So and this idea of doing the performances with the program is also very much recommended by our president, Dr. Sudhir Bhave sir, who himself is a great artist. And so it's a great panel today. And I welcome all the speakers wholeheartedly. Now, I would request Lisa to please share the first slide of the speaker. Yes, so our first speaker today is a very dear friend and senior psychiatrist, Dr. Anita Sukhwani. Anita Sukhwani ma'am is a consultant psychiatrist with 34 years plus experience. She's the founder and director of Man Healthy Mind Center since 2001, which has branches situated at Mahalakshmi in Bandra. Man Healthy Mind Center is a center with a multidisciplinary and holistic approach towards mental health. She's been the past president of Bombay Psychiatric Society 2020-2021. She's worked with Nalanda Foundation and Institute for Children with Learning Difficulties. So we welcome you, Dr. Anita Sukhwani, ma'am, and we look forward to hearing your insights on dance and mental health and the work that your center has also been doing as a multidisciplinary team, where I believe that you shared that dance is also integrated in the care of the children and the patients. So we'd love to hear your insights on the same. Thank you very much. Over to Dr. Anita Sukhwani.
Thank you so much. First of all, IPS West Zone for having me here, and particularly to Darpan. And great to be here. Thank you for the great introduction. Only a slight error, not 34 years, it's around 27 years. And I just start with sharing my slides. Then I'll take it from there. Okay. Can anyone see? Everyone see?
Yes, ma'am.
Okay, I'll just. All right. So I'm here today thanks to Darpan. A while ago, we were bonding over lunch at a conference and we were talking about our experiences. And she asked me a question that, how do you de-stress? And the first thing that came out of my mouth was dance. That's what I love doing. And whenever I'm, come back from my clinic.
One
or-
second. Anita ma'am,
Yeah.
your video, can you turn it on? Your video?
Sorry.
Yes, yes.
Okay. Sorry. Okay. So that's how this started. And when she started this whole journey on this platform here, and she asked me, I'm not a trained dancer. Maybe I was trained in my childhood, but I just love to dance. And that's what I'm going to talk about. So she was not moving.
Right. And business.
Mm. Just a minute, it's not moving this way. Okay. Yeah. Okay. So just to share a few insights about what does dance mean to me. I mean, we all have danced informally at weddings, at parties. And how does dance affect me? Why do I use it as a de-stress? And I'm sure you all feel the same. What I'm expressing here is that when I dance, I'm in the moment, I'm at the present. I'm not worried about what's going to happen tomorrow. I'm not ruminating about the past. I'm smiling, I'm gesturing, moving, laughing, I'm expressing myself, and I lose sense of time. So it's what it comes across to me. It's a conversation between my body, my soul, and that's how I'm expressing myself. It's a movement. What is dance? It's actually just a movement. And we are, as the first breath we take, it's a movement. Movement defines us from birth to death, from the first kick in the mother's womb to our last breath. We participate in the dance of life. Movement allows us to share emotions, connect with others. Our breath and heartbeats are constant reminders of life's pulsing rhythm. Without movement, there's no life. And let's look at it in this manner. Why not? I mean, the way what dance does to us is when I thought of, that why not use dance in therapy? Of course, it was being used, but introduction of dance therapy into my center came from the feeling I get when I dance. There are so many physical and mental health benefits from it. It is a niche form of psychotherapy that uses movement as a core component. And because that movement, the core component of dance is to heal and integrate the mind, body, and soul. If you look at it when you're talking to your patients, when they're unable to dance, unable to express their feeling, that's what I resort to. That okay, let's look at dance therapy. At least there will be communication. So people in treatment communicate conscious and unconscious feelings through dance. Dance therapists help people with the use of different kind of vocabulary. At its very simplest, dance movement therapy uses creative movements and dance in a therapeutic relation. You don't have to be a dancer or you don't have to have any dance skills to participate or benefit from any movement therapy. The only requirement for dance movement therapy is your heartbeat, your breath, and your willingness to explore yourself. So let's understand. I'm sure Akshara is going to be talking more about this. I'm just touching on this. The underlying principles of dance movement therapy assume that your mind and body are interconnected. Any changes that happen in the mind affect the body and vice versa. It focuses on non-verbal communication. Therapists can help people from young children to elderly people and those who may struggle to speak. Very often in my clinic, when I come across, with my medications, I'm able to help them achieve some remission, but at the, that they don't want to open up. Are not open to CBT or EBT or any other therapeutic interference. I offer them dance therapy and you should see their face. It just brightens up their face. Oh, why not? Let's explore this. So it does help people who don't want to communicate, but they communicate through their body. Let's just touch on the benefits. as I explained, what I felt, it relieves stress. It improves my brain function. I lose weight. It stimulates my imagination. It is a social skill. It improves social skills because if you think I look at imagine myself on the dance floor, I'm laughing, I'm talking, I feel more confident. I feel my self-esteem going up. I rediscover the beauty of life. It improves my relationship and connection with others around me, stimulates the mind and boosts my creativity. It improves my fine motor skills and my ability to control my impulses and releasing my emotions. Whether it is performed alone or in a room full of people, dance is a beautiful, creative action that cultures embrace worldwide. As both a creative art and a form of body psychotherapy, dancing can also be used as a method for treating anxiety, providing evidence to the old saying, you can dance your cares away. So I'm just going to play this little video. I'm sure will identify with what's going on. This movie Flashdance, some of us will know it, and how this girl experiences pain and how she overcomes her pain by dancing.
When there's nothing but a slow glowing dream that your fear seems to hide deep inside your mind. All alone I have cried silent tears full of pride in a world made of steel, made of stone. Where I hear the music, close my eyes, feel the rhythm, wrap around, take a hold of my heart. What a feeling, keeps believing. I can't have it all now, dancing for my life. Take your passion and make it happen. It just come alive. You can dance right through your life. Now, what a feeling, feels believing. It just come alive. You can dance right through your life. What a feeling, what a feeling. I can have it all, have it all. Just go.
Just a minute. Okay. All right. And I want to know how many of you will feel like tapping and getting up and dancing. So that's all I had to say. And thank you. I loved being here and I love sharing this song with all of you. Thank you.
I did, ma'am. I couldn't agree more. My feet were actually tapping. But yes, it was very insightful and very practical insights you gave into dance and its impact on our mental health as well as patients.
Thank you.
Thank you so much, Dr. Anita Sukhwani, ma'am. And you just set the pace for the whole webinar to follow. And like the opening batsman, you've given a great, performance. And you've shared very nice and in your own creative way, you made this presentation, which is very wonderful to listen and to understand your insights on dance and mental health. And congratulations for all the wonderful work that you've been doing at MUN, and you've been also incorporating dance, which is a great way. And I'm so happy that you took my suggestion, and here you are with your wonderful and awesome presentation. So thank you so much, Dr. Anita, ma'am. I'll request you to please stay back till the end of all the speakers and performances finish, because then we'll have a small 10 to 15 panel discussion moderated by Dr. Lisa. So please stay towards the end, because the audience might join in, and she might ask you some more questions on it. Thank you so much, ma'am.
Yeah, thank you, dear. Thank you.
Yeah. To the next slide, Lisa. Well, after a great performance by Dr. Anita, we have the second speaker here. We welcome Dr. Akshada Amonkar. She's a consultant psychiatrist. Can you spotlight Dr. Akshada Amonkar also? She's a consultant psychiatrist since 10 plus years, practicing in Panjim, Goa. After I finish introducing her, please spotlight her. Yes, she has co-founded an online mental health platform to help patients seek support during COVID-19 called COVID App. Is the current Vice President of Psychiatric Society of Goa. She's also the convener for Women and Child Health Subcommittee IPS West Zone branch, and she's member of Conference Scientific Subcommittee IPS West Zonal branch. She has various publications in various journals. So we welcome you, Dr. Akshada Amonkar, and we look forward to hearing your talk on dance and mental health. Over to you, Dr. Akshada.
Thank you so much, ma'am. Thank you, Lisa, for inviting me for such a
Yes.
fun CME. I think dance has been very close to my heart too, and Lisa knows that as PGs and when we were studying together, we used to go. Goa is famous for having like clubs, like dance clubs. So we used to all go in a group, and we used to have this fun night where we used to just dance and come back. And we have, I think, dance is something we have bonded over, myself and Lisa. So I think it's very close to both our heart, and we are there like for all the state conferences. The dance is something which we keep for our gala dinner, and we all danced. We just love dancing. So I think I'm going to speak more today about dance movement therapy. As I'll just share my screen. As ma'am has already spoken about dance movement therapy, she just introduced it. So I am going to speak a little bit more about. Is it visible?
Yes, Dr.
Yeah. So basically, as ma'am said, it's
Just
a
Dr. Akshada,
yeah.
when you begin it, just make it slideshow so the whole screen gets visible. Click
It's not slideshow because I'm seeing as a slideshow over here.
no. Go on the
Down if you
slide.
click that orange play button. Yeah,
Moment,
play button.
just a moment.
When you begin your presentation,
It's okay now.
you.
It's coming now.
Can you share your screen?
1 minute. It's stop sharing. 1 minute. Just hold on. Now.
Yeah. Akshada, when you begin your presentation, click on the first slide and then make it like the full screen view.
It is actually ma'am, the full screen view for myself. I'm able to
Just
see
click
that.
the slide.
It's
Like go to in your toolbar, go upstairs where animation, slideshow.
yeah, I did that actually. Here.
Yeah, click that and put from beginning.
Yeah, I did that. See, it's coming.
Madam, you first
It's
start
not.
the slideshow and then share it better.
Just a moment. I think I've shared and done the same thing. Lisa, can you share from your side? Otherwise, if the slides I've
Yes,
sent you, just
yes,
try from your
yes.
side if you're able to.
Yes, I'll try from this.
Just try from your side. Is it looking?
In PDF mode.
Madam, you first start the slideshow and then share it.
I did that, sir, actually. Um, just a moment. Huh? It's not visible at all.
You haven't shared the screen.
Now, anything is visible?
They are visible, but not a full screen mode.
Can you
Now?
maximize your screen? Just put that small square in the center.
I don't know what's
On
actually
a
normally I do
minus
this.
cross
Yeah, I
and
did
X
that.
there. Just make it full screen.
Just a moment. Huh? Just hold on, ma'am. 2 minutes. I'll just.
In the meantime, I couldn't agree more with what Dr. Akshata mentioned about dance being close to her and me, because since our PG days also, I would say it was more like a de-stressor that we would incorporate dance at times. So we would just play music and, dance our hearts out. So that was actually like, which I would say many students also do it during their, I mean, I do advocate even for my own colleagues, I would say. So yes, dance therapy does work in a big way. I mean, personally, I can tell you from what I have been using it.
Okay. What I suggest, Lisa, is that
Yes.
either you share.
Yes, ma'am. I think I tried. I don't know why it's not happening.
Akshita, just go ahead with whatever your screen is sharing.
Yes,
I think you can see something,
fine.
right?
Yes, yes.
Might not be the full
Sure.
screen show, but we can see the slides. Please go ahead.
Yeah, yeah.
Just
Okay, fine. Great.
just minimize
So
the right side object formatting, which is open
the
only.
thing is, you know what? I think it is. Now
Yes.
it's okay. Better.
Yes, better.
Yeah. Okay, fine. So I'll just go on this
Yes.
way.
Go ahead.
Yeah, so sorry for the delay, but so I was just saying that yeah, going to dance movement therapy. So basically what ma'am said, Dr. Anita has already introduced to us that it is a use of movements basically to promote an emotional, social, cognitive and physical integration. I mean, it's from the womb the baby starts moving until our last breath we are moving. So movement is something which is important for us for our integration into different things, like we say like a gesture, like we say hi, hi, just raise our hands and we say hi. I mean, we just meet someone, we shake hands, we kind of we are excited when we get something, we jump when we are in joy. So all these movements which we do are very important for us to express ourselves emotionally, socially, cognitively. So dance movement therapy becomes very important when a person has to express their feelings or express their emotion in a certain way when they're suffering with something. So basically, it recognizes the connection between mind and body, using the movement as a way of expression and healing. There are different stages which dance movement therapy goes through. Now, I think there are very few psychologists, psychiatrists who are really trained into dance movement therapy, and they really conduct it in their clinics also. I mean, ma'am also said that she does conduct certain things, or she advises the patients to go through some like dance therapy or something like that. Even in my case, I do ask the patients always what are their hobbies. And if the patient ends up saying that she likes dancing or he likes dancing, I do tell them like which dance will help them. Probably I've just read a few things. Like Zumba is one thing which helps in anxiety and depression, which I have noticed my patients getting better with Zumba. Some patients like this aerobic dancing, like the different dancing. So I mean, we just identified what dance can help patients. So basically, going through the stages of dance movement therapy, there are basically four main stages which are there. First is the preparation. Now this in this a therapist, he or she focuses on creating a ground or a safe ground for the patient, where the patient or the client feels comfortable and feels like exploring what exactly is wrong within, what he or she can help themselves out with. After the certain warm-up exercises, introduction to each other, integration with all the emotions, then the therapist then further, after certain sessions of preparation, focuses on to incubation. Now when incubation period starts, it's like just how we know incubation period is. Okay, they start tuning into their inner feelings, inner sensations, and the memories through movements. Some of them will have some memories of someone's death, some memories of someone, like they have lost someone through something else, or some memories of some abuse. So this is the time when the like slow incubation of the inner sensation and inner feelings happens. The therapist facilitates this by providing prompts, different types of music, or specific movement tasks that encourage exploration and expression. Now, these different types of music, all of us actually have a certain memory attached to certain music or certain dance. We all have, I mean, at least I have certain music when it plays itself. I do get tearful at times, or so if I watch certain dance, I do get emotional at times. So we do associate a certain kind of music or dance to our certain feelings. So this is a time when that those feelings have to come out. That is incubation period. Then comes the illumination period, where the client moves in ways that helps them express and explore their emotions or memories that have been brought to surface during the incubation phase. So now the client knows that during the incubation phase, that this particular thing which happened in my childhood or adolescent period is something which is hurting me, or is something which I need to get out through this movement therapy. He has to acknowledge that and express about that. The therapist will then guide the client through movement that allows for deeper understanding and processing of these experiences. Final stage is the evaluation. In this, it involves more of reflecting on the movement experience. Like the patient or the client will tell the therapist what exactly went through when they were thinking about a certain event in their life, and the movement, how it helped them basically. It will help them process the emotions and what insights they gain during the illumination and the incubation period, and this helps them to integrate this further into understand the client's overall understanding of themselves. So basically the client can tell, like that this kind of movement has made my that emotion get a little better. I have felt a little better or eased out on certain memories of mine when I'm doing this movement. Sometimes stretching our hands up, it just kind of relaxes our body. Like when we always speak of stress induced conditions like fibromyalgia, chronic fibromyalgia, and we all have, like whenever we are stressed out, we get this particular pain or stretching in the shoulder area. Even just stretching our hands up kind of helps us sometimes in relieving that, or get like easing that out. So basically this dance movement therapy also works differently on different muscles and different movements of our body, and it's really helpful. It works by mind and body connection. Okay, so it shows the connection between mind and body. It's a very good non-verbal type of communication, wherein the client can non-verbally like let himself or herself express the emotions, thoughts, and experiences through just movement without verbalizing their feelings basically. And also dance is known to help in neuroplasticity. It promotes neuroplasticity and the brain's ability to reorganize and form new connections, potentially leading to improved cognitive function, emotional regulation, and motor skills. Whom does like in whom we can use like the dance movement therapy basically? uh, Anxiety and depression, one thing. Okay, I have read somewhere that just hopping, okay, and just jumping up also can kind of reduce some anxiety. And actually sometimes we must have seen kids when they get anxious and they're scared of something, they start jumping. Okay, I don't know if you've noticed, they just start shaking their hand, they just start jumping like, out of fear. So that's where I think somehow the anxiety comes down, or it comes in control when you start jumping. Trauma and PTSD cases, the way I said, like the person is able to express, okay, what has happened, what has gone wrong, and the expressive nature of the movement helps them to feel safe, okay, and process their trauma in a better way. Eating disorders, yes, eating disorders and body dysmorphia, where there is a lot of like they have a lot of insecurity about their body, or there's body shaming. Dance somehow makes them feel their movements, feel their flexibility, feel their body. Okay, they can watch themselves while dancing, and that gives them a different confidence, seeing their body move or be flexible in certain ways. It helps in communication issues because you're able to express looking at each other. When we dance with our friends also, we do maintain that eye to eye contact, we look at each other, make gestures, make expressions, and that helps us bond. In dementia also it is being used these days. You can see that group of elderly people sitting there. It helps them, not that is not like a dance they're doing, but there's some kind of movement therapy where they are holding some like kind of long dupattas kind of, and they just kind of moving their hands and how much ever they can do. So this basically brings in again a lot of motor activity, cognitive function, and improves the emotional well-being because they're interacting with each other basically. In physical health, chronic pain, yes, but obviously the movement and exercise in chronic pain, if there's knee pain, back pain, it has to be under certain guidance. It cannot be done without any guidance. Even in arthritis, it helps improve the mobility and reduces pain. Childhood obesity, there are a lot of kids these days facing childhood obesity because of the eating habits, and it becomes very difficult to get them to do strenuous exercises or take them to a playground and do exercises. Some kids might just like the fun and engaging way of dancing and getting like themselves reduce their weight in a healthy way. So basically, neuroscience of the movement, the dance movement therapy says that obviously it engages various brain regions which are important. Mostly, most important, the motor cortex, the cerebellum, which is going to depend, like that's how the movements will depend on. Okay, somatosensory cortex and basal ganglia, which are involved in motor planning, sensory integration, and emotional processing. The neurochemicals release, we all know endorphins. They release when we dance and we're doing something very exciting, which have got mood boosting and pain reducing effects. Mirror neuron system gets activated when you're looking at your therapist and dancing. You tend to copy the therapist, you tend to copy the expressions, tend to copy the positive energy the therapist is throwing. And that's how this plays a very good important role in empathy and social understanding, which is also relevant to the DMT. By observing and engaging the movements, individual can enhance their understanding of themselves and others. So basically you start comparing and seeing that, okay, fine, that the therapist is dancing so beautifully with so much of positivity, even I can do the same, I'm also able to do it. So that gives in a different confidence. Stress reduction, it reduces stress, it reduces anxiety by prompting relaxation, improves mood, and releases endorphins again. So these are the few dance forms which I had read about a little, and that helps in, like, they have some potential benefits. Bharatanatyam, Kathak, and Manipuri, which is like we normally many of the girls, like young girls and now boys also have started going. Like I have put my daughter for Kathak, and I feel nice to see that there are some young boys also coming in for Kathak dance, which is really nice because somewhere down the line it's like the folklore where we. When the kids are dancing together, this Kathak and Bharatanatyam, it works a lot on storytelling through body language and facial expressions. So it helps a lot in emotional regulation and mindfulness. So basically, when you're focusing on your body language and the expressions, okay, so that gives a lot of mindfulness for the young kids. And if you start young, I think it helps a lot in keeping that balance in you. I mean, I always wanted to learn dance when I was a small kid, but that time I think somehow the logistics did not work and I could not join a class. So it always remained in me that I could not do it. I do love dancing, I dance the way I can, but that Kathak or the disciplined dance form, which I could not learn, I'm sending my daughter so that she learns. And I feel that that will bring a lot of focus in her life and will have some discipline in her life too. This can be incorporated into therapeutic frameworks to address anxiety, depression, even autism spectrum disorders to some extent. The free flowing dance, which we all normally do for our functions and the parties, it facilitates basically emotional expression, self discovery. Sometimes you just end up doing a step and you are like shocked, oh, how did I do that step? So sometimes it's like just self discovery. Social dance like ballroom dancing, salsa, tango, which are more of disciplined dancing, they help you with enhancing social skills and create a sense of community. So there are a lot of community in Goa. We have got like this dance, like classes which a lot of people go to just learn ballroom dancing or salsa, ballroom dancing before Christmas, and there are New Year dances. So people do go as community and they learn dance, and it's really nice for them to engage with each other. Some other forms of dance which are there are Tai Chi. Okay, it's known for the balance and mental function, particularly older adults or individuals with movement disorders. Tai Chi helps apparently. African dance, you must have seen the African. It's very like it's very aggressive kind of, and it's more of hopping and jumping and with the drums. So this is known to reduce stress and increase positive effect around. And hip hop, which is a very popular form of dance, can be used to express emotions and build confidence too. So this was about some dance forms which I found would be important, and I thought I'll share with you all. So this is about dance movement therapy, which I had to speak on. Over to you, Lisa.
Thank you, Dr. Akshata, for very elaborately explaining the different stages of dance movement therapy. But I mean, I myself have got a lot of insight from these elaborate stages involved. So thank you for sharing that, as well as your personal experience with your daughter being part of, and how it helps, I mean, in emotional regulation, especially at that stage. Thank you for that.
In fact, I've seen a lot of change in her. Like she used to be very cranky till the age of 5. Now she's 8. But since last 1 year that she's going for the dance, she loves her dance classes. And then that's the only class she loves actually. I've put her for some different classes also, but that class she never wants to miss. So I like that, she also loves dance like I do. And now she's going to learn it in a disciplined way. But I could, I mean, it remained, but now she's going to do it in a disciplined way. So let's see how she does it.
So thank you, Dr. Akshata Amonkar. It's been very nice listening to you. And we had somebody, Dr. Anita, speak from Bombay, Maharashtra. Now you're speaking, representing Goa. So it's very nice. And Dr. Anita shared it in her own, on dance movement. And what you have highlighted are a lot of, studies and research where dance has been effective across so many psychiatric disorders. So it's a great education to even the psychiatrist and allied mental health professionals who are attending that it's a concept, but a lot of people have already, done it across groups, and it can be, encouraged for Indian psychiatrists also to look at this aspect and study it and see how they can implement it across their rehabilitation programs or across clinics. So thank you very much, Akshata Amonkar. It's a very nice presentation. And I
Thank you.
request you also to please stay back till the end of the performance. And then Lisa will moderate, or Lisa will moderate a panel discussion, spotlighting everyone. So please be there. So thank you once again. And now we move to the third speaker. Dr. Lisa, can you please share the slides? Yes. So can you please remove the spotlight from Dr. Akshada, and can you just screen share Dr. Ankit's slide? Yes. One minute.
Is it not visible? Dr. Darpan, is my slide visible?
Yes, it's visible. So thank you, Dr. Lisa. Now I will introduce the third speaker in our speaker panel. We have with us Dr. Ankit Panchmatia. Dr. Ankit is consultant psychiatrist with 9 years plus experience. He's practicing at Ahmedabad, Gujarat. He's ex-assistant professor at SMS Hospital, Ahmedabad. He has various publications in indexed national and international journals. He has special interest in de-addiction and sexual psychiatry. And now I will add special interest in dance and mental health also. So over to you, Ankit. We look forward to listening to your insights on dance and mental health. Thank you.
Yeah, sure. Thank you very much, IPS Bader, for inviting me. This is my first meeting with you guys, and I'm looking forward for many such further meetings. Am I audible to everybody?
Yes, Dr. Ankit.
Yes. Okay. So moving forward, today the topic is dance and mental health. There are various types of dance like ballet, ballroom, contemporary, hip hop, jazz, classical, Zumba. the all type of dance has more or less mental health benefits. And today I'm going to describe how it happens. So overall, dance significantly benefit our mental health by boosting mood, reducing the stress and anxiety, and improving overall well-being. But actually, how it happens? So when we dance, there are release of the certain chemicals or neurotransmitters in our brain, and it by releasing from the brain, it helps our mental health. The first one is endorphins. When we dance, it increase our heart rate, and there is a exercise to our muscles. So basically, endorphins is produced in the pituitary gland and hypothalamus. By doing dance, it releases from there, and it has impact on our body. What it does exactly to our body? Endorphins is basically pain relievers, so it helps in that. The another thing is it is a natural mood booster. The third thing is it reduces the stress. It also gives feeling of pleasure and well-being. It also regulates the immune and inflammatory response. So when endorphins release, it does all these functions, and by that way, it significantly help in boosting our mental health. The second neurotransmitter is dopamine. We all know that dopamine is basically act on the reward and that reinforcement circulatory system. So what happens when we dance? There is a release of the dopamine in our brain, which gives the feeling of pleasure and that reinforcing behavior, and it motivates us to seek out the same activities that gives us the reward. So here it is a dance. So it gives us the motivation to keep on dancing, keep on dancing. Dopamine will release, and there is a circuit of reward and reinforcing behavior. The another advantage of dopamine in your body is it increases the attention and focus. Also, it helps cognitively as well, executive functions, as well as it involved in learning and memory. Also, it improves mood and sleep as well. The third one is the serotonin. We all know that serotonin level in our brain will, if increased, it helps in the depression and anxiety as well. So the function of serotonin is in our brain is mood regulation. It gives the feelings of well-being and happiness. The another function is sleep-wake cycle regulation. So by that thing, our sleep and wake cycle also regulates. The third thing is appetite and digestion. It influences the gut motility and nutrient absorption. So our digestive system will regulate. The fourth thing is it helps also in memory and learning and modulates the pain signal as well. So basically, there are three neurotransmitters which helps. The first one is endorphins, second is dopamine, and third is serotonin. Now, the dance also has cognitive benefits. How? It improves our memory, because when we dance, we have to remember the steps, we have to remember the choreography. So by that, our brain also works and it improves our memory as well. Dance develops some new neural connections in our brain in the regions specifically involved in executive functions, long-term memory, and spatial recognition. So these are the some cognitive benefits. The third one is dance has some social and emotional benefits as well. How? Because when we dance, generally we dance in a group. We have, if we join the dance class or Zumba class or any such type of studio, there are group of people who dance together. You have partners, you have groups. So you make a social connection with them. So dance gives the opportunities for some social interaction, building relationship, new group, new interactions. You share your problems, they share their problems. So basically, it is crucial for our mental well-being to be socially connected with people. The second thing is emotional expression. When we do the dance, we have sort of some facial expressions, some body expressions. In some dance, we used to laugh. In some dance, we have to express ourselves. We have to show our facial expression. So by that, it is a powerful way to process and release our emotions. So it is also one benefit of the dance. Now, moving forward, dance can also improve psychological coping and overall well-being. The another thing is dance gives us a confidence, a compassion, and increase our self-esteem. How? Because in dance we have to learn new moves, we have to learn new steps of the dance, we have to keep on learning new steps, new choreography, new dance. So by that way, if we learns that and if we did mastery in that, our self-esteem will increase. It will boost our confidence and our compassion. So it helps in that way also. There is a role of music. See, music is a key component of the dance. So what happens when our favorite music plays in the dance? It enhances the experience by stimulating the brain's reward center and activating some sensory and motor circuits. So in the music has also a crucial role in helping our mental health. Now moving forward, there is a dance and movement therapy. Dr. Anita ma'am and Dr. Akshanda ma'am has very well explained that about that. It is a type of therapy, though somewhat less well recognized, but yeah, it is a type of therapy that uses the movements to help combat various type of the psychological disorders. So these are my some inputs about the dance and mental health, that how doing a dance releases some neurotransmitters, and by that way, how it boosts our mental health, it improves it is basically a stress buster, and it also helps in improving the depression symptoms, anxiety symptoms, and other various psychological disorders. I myself doing Zumba since last almost 2 years regularly, and it helps me a lot. When I do it, I do it almost 4 to 5 times per week, and there is a 1 hour session. In that 1 hour of session, I feel very good, and I forgot about all the worries and all the stress of the day and the negative thoughts and everything. So I literally enjoyed that 1 hour of session of the Zumba. So I myself has experienced the mental health benefits of doing a type of that type of dance. So yeah, I recommend all that. If you are interested, please do it. You will see the benefits of that. Thank you. Thank you very much.
Thank you, Dr. Ankit, for sharing that, especially the neurophysiological aspects and how it's impacting you.
Thank you. Thank you so much.
Thank you, Dr. Ankit, for your excellent presentation. And without PowerPoint, you have given your talk, which is very nice, because a lot of flow of thoughts and a flow performance it was, and you shared your ideas. And what is very good is you brought out the neuroscience perspective and how what is the neurochemistry and how dance is overall affecting which areas of the brain. So that has been a very nice insight. So I think that today's webinar, all the three speakers, Dr. Anita has covered the practical aspects, and Dr. Akshara has covered lots of research highlights, and Dr. Ankit, you have brought out a very fundamental neuroscience aspect of dance, so it can make a wonderful paper or even a book on dance and mental health. So thank you so much, Dr. Ankit, and please stay back for the, it's a very nice presentation, and stay back for the panel discussion. And now over to you, Dr. Lisa. Can you quickly just screen share the CV slides of the performance? I'll just one by one introduce them. Then if they are, you can, Lisa, welcome them after I introduce them. If they are present, you can play the dance and you can talk about the performance. And why did you choose this name? Can you remove the spotlight from Dr. Ankit? And Lisa, please start screen sharing.
Yes, Dr.
Yes.
Then just give me a second.
So now we move on to the dance performances, and the first dance performance on the screen is being done by Dr. Abhijit Pai. He is our Honorable Secretary of IPS Western Zonal Branch for 24-26. He is Professor of Psychiatry at Datta Meghe Medical College, Nagpur. He has a clinical experience of 14 plus years, won various awards in research and presentations, website committee chairman of IAGMH and IPS. He's co-chairman of Social Security Scheme of IPS, and he's past secretary of Psychiatric Society, Nagpur. So we welcome you, Dr. Abhijit. Is Dr. Abhijit present here, Dr. Lisa, now?
No, Dr. Darpan, due to some personal commitment, he could not be present, but he did share a video.
The audience to know that it was Dr. Sudhir Bhavesa, President sir's request that Dr. Abhijit Pai should perform. And so we are sharing his dance performance. And due to some personal reason, he has been unable to dance. So Lisa, can you just introduce a little bit about his dance title before you play it?
Yes,
after you
so yes, so probably after we play it, that will be more meaningful, I would say. Okay, yes. Let me play the. Is the sound audible? Wanted to confirm.
It came at the beginning, Lisa.
I came, right? Okay.
Yeah, it
I'll
came, it
continue.
came.
Thank you.
Yes, play from the beginning.
जिसकी दीवानी बिकती हर बाजा वो किसना है वो किसना है वो किसना है वो किसना है किसना है प्यार में डूबी प्यार में खोई प्यार की धुन में जागी न सोई दुनिया से है वो अनजानी सब कहते हैं प्रेम दीवानी किसना से मिलती है भूल के हर बंधन हो किसना की माना की जपती है वो जोगन राधा
So that has been a wonderful performance by our Honorable Secretary Dr. Abhijit Pai and along with his wonderful wife. So as you have seen, I mean, that's why the title comes Step by Step Create Magic. It builds the bond and as Dr. Anita, Dr. Akshata and Dr. Ankit mentioned, it strengthens relationship, it strengthens bonds. So hence the topic title of the dance, Step by Step Create Magic. Yeah. Going to the next.
Yeah, thank you, Dr. Lisa, for sharing Dr. Abhijit Pai's video. And like you said, step by step create magic. His dance performance was very fantastic and very magical and very true to the spirit of its title. So we thank him very much for sharing his presentation. I mean, his video of his dance, and we thank him for participating in the program. Yes. So over to you, Lisa. Can you share the next slideshow?
Yes. Sure. Next, we have Dr. Tanvi Pednikar.
Yes. As the chairperson, I will welcome Dr. Tanvi Padnekar. She's a consultant psychiatrist with 8+ years experience, currently program officer for district mental health program at community level in Goa. She's past member of Women's Psychological Health Subcommittee IPS, Western Zonal Branch from 2022 to 2023. She's past member of Public Relations Committee of IPS 23-24. She's joined Secretary at Psychiatric Society of Goa, and she's member of IPS West Zonal Branch Public Relations Committee. So welcome, Dr. Tanvi Pednekar. Can you spotlight or is she present in this webinar? Tanvi, are you present?
Yes, we have
yes,
Dr.
I'm
Tanvi.
Yes. Can you spotlight her and she can speak something and then we can have a performance. What is the title of Dr. Tanvi's performance? It is
Dance to Your Own Beat.
Dance to Your Own.
Hi everyone. Beat.
Yes. Beat. Okay, very nice. Thank you. So is Dr. Tanvi, yes, how visible? Yes, over to you, Dr. Tanvi. Yes.
Yeah, thank you so much. Hi everyone. As everyone has spoken so much about dance and mental health, I've always loved dance, though I'm not a professional dancer, but to experience the joy of dancing, I've always been, wanted to learn dance. I started with Kathak, but I couldn't complete it
So
entirely.
you can stop it.
And sorry.
Lisa, you can put Tanvi on full view and stop the screen share. Yes.
Yes.
No,
Thank
Tanvi,
you.
continue.
And yeah, so as Indians, I think for our first performance, it's usually when our parents tell us to, perform in front of the relatives that come. I think those are the first performances that we have. And then followed by that, the dance journey went on to some school competitions, some performances at the annual gatherings. And then after that, with the MBBS and all, we were a little busy and the dance was left out a bit. But yeah, I used to enjoy dancing, as Akshada and Lisa also rightly mentioned. We wait for that yearly annual conference for the gala dinner when we all meet and dance our all hearts out. And when Lisa asked me to, do a video and share, so initially I said yes to her, and then I was searching for choreos and I was trying to perfect each and every step. But then I thought to myself that dance for me is more about, feeling the music, expressing yourself, and finding the joy in that music. So that is what I've done in the video. I've danced to each and every beat and tried to move with the rhythm and the flow and feel the joy of it. That's it.
Thank you very much, Dr. Tanvi. It's very beautifully expressed that be in the moment and enjoy. Lisa, over to you, and then you can play the video.
Yes. I couldn't agree more to you, Dr. Tanvi. And let me
Lisa,
see the
you'll have
video.
to stop the highlight of Tanvi right now. Remove the pin.
Sir, can you take off the pin, please?
Unpin Dr. Tanvi so that her video is shared on the full screen. Yes, thank you.
Nice. Thank you.
रोशनी ही रोशनी है चार सू जो चार सू इश्क है ये इश्क है इश्क है ये इश्क है तुमसे मिले तो कुछ गुनगुनी सी होने लगी है सर्दियाँ तुमसे मिले तो देखो शहर में खिलने लगी है वादियाँ साया मेरा है तू और मैं तेरा तू दिखेगा ना दिखे तू तेरी खुशबू बू इश्क है ये इश्क है इश्क है ये इश्क है इश्क है ये इश्क है इश्क है ये
Thank you, Dr. Tanvi, for sharing that recording and sharing that wonderful, graceful dance performance. I know it was a bit
Thank you.
last minute, but it actually shows the joy that you felt and you expressed in the form of dance. So thank you for that.
Thank you.
Thank you, Dr. Tanvi, for sharing your performance.
Yes.
How do you feel after this? We want to share your thoughts after seeing your video.
Yeah, I think I danced it was a little nostalgic. I remembered how in early days, whenever something used to come up on TV, my sister would look at the steps, start performing ourselves, and that is what I did. I left all the choreo and I thought of just doing it that way, the way I felt it, the way music felt, the way the lyrics felt, just doing it that way. So it felt good.
Okay, thank you very much, Tanvi. Dr. Tanvi, it's a great performance and a great message for the audience that you have given that very true to the title of your presentation. Your dance has been very beautifully expressed. So thank you so much. Thanks. And please
Thank
be
you. Yeah.
there as part of the
Yeah.
panel. Lisa will be conducting it shortly. So now over to
Okay.
Lisa for sharing the screenshot slide for the last dance performance.
Yes, Dr. Darpan. Yes. Welcome you, Dr. Charmisha.
Yes. So I shall introduce Dr. Charmi Shah. She's a consultant psychiatrist with 13 years experience. She's consulting owner of Divine Psychiatric Clinic at Ahmedabad, Gujarat. She's worked in various medical institutes in the past. So over to you, Dr. Charmi Shah, and we look forward to understanding why you have chosen this dance performance and your thoughts on dance and mental health. So is Charmi present over here, Dr. Charmi?
Yes, ma'am, I'm here.
Can she be spotlighted? Yes, she's spotlighted. Okay. So, Dr. Charmi, can you share your thoughts and then we see your presentation?
First of all, I'd like to thank Dr. Ankit and Dr. Lisa for giving me this broad platform. Dance is a passion and love for me, but my story is as similar to as Dr. Tanvi. I have not trained in dance anytime, but it was like hobby. But because of studies and because of motherhood, it was left out. But since 1 year, I have resumed dancing, and dancing is a therapy for me. Not I'm not talking about only patients, but as a doctors we also feel lots of stress. Being a psychiatrist, we also face so much negativity around us because everybody is complaining to us. Nobody is coming to share that joy. So to handle that negativity and handle that negative emotions, dance is a wonderful thing. As Anita ma'am already explained in her presentation, that dance is a way of expressing our emotions, expressing the feelings that we are already having inside. So I have chosen a song which has some kind of sadness in it, like a girl who is fed up from the toxic relationship and she wants to go away, but she cannot say that, she cannot leave from that. And that emotional expression I have done through this song. So I give the title that Beat the Blues with the Moves. So if you are feeling low, just get on the dance floor and let the blues away. Thank you.
Thank you, Dr. Charmi.
Lisa, you can introduce our topic and
Yes. So as she mentioned, her title is "Beat the Blues with the Moves." So I'm sure the expressions will say it all with her expressive movements. Thank you, Dr. Charmi, for sharing. I shall play it. Sorry.
ਧੜਕਨ ਤੱਕ ਤੈਨੂੰ ਰਸਤਾ ਦਿਆ ਸਜਣਾ ਤੂੰ ਤਾਂ ਸਾਰੇ ਦਿਲ ਤੇ ਹੀ ਕਬਜ਼ਾ ਕਰਕੇ ਬਹਿ ਗਿਆ अब नहीं रुका दिल तो यकीन कर पाएगी तू तो इश्क ही ठग बैठा सजना जा रांझड़ तू भी क्या याद रखेगा जाहिर ने तेनू छोड़ दिया जा रांझड़ तू भी क्या याद रखेगा जाहिर ने तेनू छोड़ दिया ऐसे ना जाओ पिया ऐसे ना जाओ पिया जुड़ी है राहें सारी तुझसे मेरी ऐसे ना जाओ पिया ऐसे ना जाओ पिया जुड़ी है राहें सारी तुझसे मेरी जाना रांझड़ तू भी क्या याद रखेगा जाहिर ने तेनू छोड़ दिया लख समझाऊं मैं तो दिल समझने पाता मांगे तेरी खैरिया सोना था तेरा वे झूठा
Thank you, Dr. Charmi, for that very expressive dance performance. I mean, you could actually feel the emotions from the way you expressed in that dance form. So very touching. Thank you for that.
You.
Thank you,
And
Dr. Charmi. Very nice performance, very expressive.
Thank
And want to understand your thoughts. How does it feel after seeing your presentation?
Ma'am, it's like, as I said, the dance itself is a therapy for me. I always dance whenever I'm feeling not good, or even at that time, whenever I'm feeling excited. Even my daughter, she is 7 year old. So we both love dancing. So whenever we are happy, we are dancing. Whenever we are sad, we are dancing. So dance is a way of expression for both of us. And it's like I'm not trained in that, but dance is like, the thing that I love to do the most. Being Gujarati, we do garbas, and like that garba itself is a therapy. That those 9 days are like too good for all of us.
Thank you very much, Dr. Charmi Shah. It's a very beautiful and very expressive dance performance you have done. Very true to the title. The title of her presentation is Beat the Blues with the Mood. So very nice and very beautiful performance. So thank you. And now I request our technical admin and Lisa to spotlight all the speakers and all the dance performers, myself and Dr. Lisa in a panel. Yes, Dr. Charmi, Dr. Tanvi, Dr. Akshada, Dr. Akshada Amonkar, Dr. Lisa, Dr. Tanvi, Dr. Akshada Amonkar. Can you? Yes, so everybody, all the three speakers and the performers are there. Is Dr. Abhijit there?
no, Dr. Darpan, he's not. Okay. Yeah, so I think it has been a very power-packed, very interesting, and I would say we danced our way out through our webinar. So any questions if we have from the audience to any of our panelists first? Okay, in the chat, we do not have any questions. Okay, if anybody has any questions on audio. Okay, I think we do not have any questions, but I have some questions. So I wanted to ask especially Dr. Anita, you mentioned that you'll have a center for dance and music therapy. I mean, you'll incorporate it very actively. So, ma'am, could you share some challenging incident or something in how it impacted a particular patient in a big way that, dance therapy has us just for all of our knowledge?
So I'll actually come to how I started it. Way back in 2012, I started my daycare center for patients recovering from schizophrenia. And I called upon, like I said, I love dancing. It has been very therapeutic for me. I've learned a few dances, but never really professionally. So I said that must be one of the therapies that I must incorporate. And we called upon Shamak Dhawan, and he has that, the social aspect of their branch. And he used to send once a week his dancers to do therapy with my patients. And I saw, every month I saw most of them improving so dramatically. And the feedback that I used to get from their treating psychiatrists was tremendously positive. And COVID unfortunately hampered our work with the daycare center, but I took it on as a group therapy and a personal level at my clinic. I have a great dance therapist, and she also does home visits. And now we are focusing a lot on geriatric patients. So that's what I wanted to share. Yeah.
Thank you for sharing that, Dr. Anita. I mean, it's nice to hear. I mean, it went to that level that you all incorporated, a trained dancer like Mr. Shamak Dawar, and to help patients and to see that impact via various, I mean, it's very very nice to see that how actively it's being incorporated to help patients. So nice to
Thank
know
you.
that.
Thank you.
Yes, Doctor. I wanted to ask Dr. Akshada. So you mentioned that autism, and especially you mentioned about child regulation, how it helps. I mean, any instances or anything. I mean, which you think it changed in a major way, especially for kids, more so with your daughter and her
Yeah.
peers.
So basically, see, what I realize is that kids have to have some form of art which we have to incorporate in their upbringing. I mean, that has to be there. Other than the other principles which we teach them, art or any cultural thing has to be incorporated. So, dance per se, when I speak of, I have seen it regulate a lot of emotions in kids, or even for that matter, music. I do tell the parents, like many of the parents these days are coming with a lot of, the other day one parent came, 5.5-year-old child. Actually, the mother is burnt out with her work at workplace, so she's displacing her anger at the child, and the child is behaving in an odd way at home. Okay, and she doesn't know what to do about it. So I asked her, have you put him through something? She's like, he doesn't go only. I've tried it one or two times. He's not gone. So when I sat with the child and I asked the child, he said he likes to play tabla, but mother has put him for something else. I mean, the child knows. So what I'm saying is, the child, as kids, if they are given some way of expressing their emotions through art or through some cultural learnings, that will help them regulate their emotions. One thing is, they'll meet peers who are doing the same thing. There, they are able to emotionally bond with their their age kids. At the same time, in cases like autism spectrum disorders, it does help in that movement which they like doing. So even slight jumping or hopping kind of gives them that sensory stimulation, which makes them feel a little better and makes them feel connected. So probably they'll have a good connection with that teacher who's giving them dance therapy or helping them just hop and make that movement which makes them feel nice. So I think in kids it's very important that we start doing it right now, because it will help them as they grow up. It kind of keeps them grounded.
Thank you for sharing that perspective. I mean, how important it is to start at a young age. I mean, it goes a long way it starts from young, like they say, right? All these preventive measures and things which will help them, like what do you say, like a buffer, like something which they can go back to when they face such situations or if they face such mental health issues. So thank you for sharing your perspective and insight on that, Akshada. Yeah. Dr. Ankit, I had a question to you. So you mentioned very nicely how you started yourself Zumba, and how it impacts, especially in terms of, I mean, considering the neurochemical aspects, everything. I mean, any more insights on that perspective? I mean, because we are also sometimes we get burnt out, be it professionally or personally. I mean, it would be nice to hear a bit on that.
Yeah, sure. See, when I was in MBBS, I started joining this one studio, and in which there is a Zumba as well as aerobics activity were done. So during that time, I did the Zumba and aerobic activity. Initially, I joined the thing, not thinking about it was not my passion. The Zumba and the dance, it was not my passion. I joined as a form of exercise, that there is a bit of exercise to require to my body, so I joined it. But as the time passes, I started enjoying it. I started feeling good. So gradually over the period of time, it becomes my passion, it becomes my hobby. So as the time passes, as I do more and more Zumba and aerobics and all type of dance, it becomes my hobby. I started enjoying and I started liking. And gradually I also see that by doing that, there is a help in terms of physical exercise to the body, as well as there is a lot of mental health benefit in terms of it relieves our anxiety, it relieves our stress, it relieves some negativity. We forgot everything in the period of time that we are doing. We are engaging in the dance or a Zumba or any sort of activities. So uh, eh, that one or sort of period of time, I enjoyed a lot. I enjoyed thoroughly without thinking anything else. So it definitely benefits me, and I also recommend anybody that please try this thing. if you are enjoying it, if you are going to like it, you extremely going to be happy by this. So there are a lot of benefits.
Thank you, Dr. Ankit, for sharing that personal, especially personal experience that you had during this journey. I mean, it's very motivating for us also, those who have not started, to just shake a leg maybe when we are too stressed out, because it will help all aspects. Also our patients, because I mean, we go to the clinic, we can go with a more clear, more calmer mind, I would say. So yes, I think that's something we could try to incorporate. I mean, now, especially after knowing the various researches, the various stepwise stages, how it actually impacts, I mean, in that detail. So yes, thank you to all our speakers for really preparing a very elaborate and discussing with all of us and giving your perspectives. Also, thank you, Dr. Tanvi and Dr. Charni. I mean, you all have very nicely mentioned your experiences, how it has been, and especially preparing this video and sharing. I mean, it's been how it felt, how each step felt, how you wanted to show emotions, be it Dr. Charni with the beating the blues, or Dr. Tanvi in the joy coming out. I mean, it's been very inspiring for us also. Maybe we should try doing it, if something we have stopped doing since a while. So that's been really motivating, I think, for us. Anything you'd like to add, Dr. Tanvi or Dr. Charmi? Okay. Yeah, I think that's it, Dr. Darpan, from my. Anything you would like to add, Dr. Darpan?
Dr. Lisa, you have moderated this webinar. You dance yourself. What are your thoughts on dance and mental health?
Yes, Dr. Darpan. I mean, I couldn't agree more to what all our speakers says. For me personally, dance has been my stress buster, you can say, since my childhood. Because I remember college days, we would have this every quarterly, like this dance sessions. We would like dance the night out, literally the night out. I mean, we would go for like 4 hours also. But those were the best memories in terms of social bonding, as well as it's when you have a busy schedule. I think these things come in a long way. We don't realize it, because there are these ways we can naturally do things, you know. Yes, I feel in a big way it helps our mental health. Also, I have seen various I mean, especially elderly people. We have, like in Goa especially, there's some of these groups that they meet, the elderly meet together, and they have this dance movement, not like a very what do you say, a fast movement, but even thing like put your hand up, right, with music. But it goes a long way, because it builds the community, it helps them, you know, social interaction, it helps their memory, because they remember the steps, you know. So it helps some of these dementia patients, I would say. It helps them bring down their irritability to an extent. I mean, I personally have seen somebody, you know, be a little calmer when they dance. So I think it comes a long way if we per me, if we incorporate dancing a lot in our practices, like how many of them are already doing. But probably it needs a little more practical incorporation, is what I feel from my perspective, as well as what they have mentioned. Yes, but it's been a very so that's what, dance has always been close to my heart, and I would say it's one of the best forms which will help you in best non-verbal communication also, like how our speakers have beautifully mentioned. So many times we cannot voice what we feel, we cannot express for whatever reasons, for whatever circumstances. But when you dance, there is no inhibition. You just do the expressions, you move your hands the way you want, just to let that emotions flow. So that comes a long way in some form of, you know, expression, which helps you in a big way, is what I feel. Yes, Dr. Darpan, that's my perspective.
Okay, thank you everyone. So I would have been nice if somebody would have asked me my perspective also, Dr. Lisa.
Yes, we were waiting for you, Dr. Darpan, before you asked me.
Otherwise, I have to close this.
Mostly.
Fine. So first of all, I think that this is the first time that so many psychiatrists who have interest in dance, we have been able to bring them all together on one platform. So I think that congratulations, Lisa, you moderated it very well, and you taken a good lead as a member to organize this program. And what I agree with thoughts of all the speakers and the performers, that there are so many aspects. When I just thought that day, few months ago, when I spoke to Dr. Anita, that no, I want to do something on dance and mental health, and then how, how our poetry, storytelling format, we added performances. So it was first so challenging to collect everyone from the states because we didn't know who was dancing. And we knew some people dance, but who could actually dance, who could actually speak. So the whole month went in researching, understanding, getting recommendations from people, and then put all together. And so just this whole webinar has is very resourceful, because I don't think any time before that dance and mental health from a psychiatrist perspective has been collated so well with practical clinical aspects, research, academic, and even neuroscience aspects. And even the three performances that have linked to the expressive aspects, or well-being aspects, so it's been a very fantastic webinar in its content. I mean, I truly appreciate it. And sharing a quick glimpse of my journey, like in school, I was in young days. I think when I was very small, I liked dancing, and the only way was to see the TV and see the songs and being played in the movies. And I'm sure all of us who are interested in dance would watch the TV and copy the steps way back in 1980,
Yes.
and then
Yes.
practicing it. Or if there were some weddings, and then we just perform, or the in various I remember society Ganesh Chaturthi festivals, or some dance competitions in schools. These were the platforms that we were going and performing for solo dances. And then in school, as we grew older, all the schools started group dance competition, solo dance competition within the school as part of festivals. So that's where I first learned Bharatnatyam a little bit when I was small, but I couldn't pursue it well. But my interest came in folk dance. So the first proper dance that I learned was Rajasthani folk dance. And we were taught folk dance competition by one very famous teacher, Veena Pandey or Pange. I don't remember her name. So she used to come to our school at Auxilium Convent. And for 1-2 years, I think she taught us some folk dances. And those songs like Mera Asi Kali Ka Lehenga, Resham Ka Rumal, we all the girls, school girls, did dance, learned folk dance on it, and the whole dress of us, wearing those. It was very nice. It had a special ghagra, I think, for those Rajasthani dance performances, a pot, and all the things. So it's very nostalgic for me to think that in the young days I learned folk dance and we performed. And then one day in school, I saw that two girls did a performance on the Dance of Envy, and that was the first time I looked at the stage as another school student. And then we knew that these two girls were trained from Shamak. They were in our school, and they performed so beautifully well, and it was such a wow moment for me, just reflecting back. And then after, I think, some months, we Shamak Dawar started classes in our school as well, and like 1990, maybe 96, 97, or 98. And during this school, I didn't join it. But then after completing my 10th, I was very keen to learn the dance that I had seen. So I think somewhere after 10th, I joined Shamak in some vacations, and then throughout junior college and even medical college, I continued to learn dance, and I completed basic. I had basic, elementary, inter, advanced. So I tried to reach one of the highest levels, and we had very fantastic teachers, and there was this annual summer funk show where all the students of various ages would perform, and it was annually held. So it was very nice journey through dance at that time. And I also started teaching children sometimes dance in our society. And I also, won in Garba also, in Dandiya I won, and folk dance, Garba. Western was my main interest. And then through college, I started collecting my batchmates and taught them dance. And we performed at various intercollegiate events and festivals at Sion Medical College, at KEM, at KJ Somaya, DY. And that was a thing, So year after year through my MBBS, then I trained my junior batches, and I was teaching them all to perform and win prizes for the Western dance. And sometimes I did solo, sometimes we did duo. So my undergraduate journey was filled with a lot of dance, and it kept me, going and happy. And I did well in my studies also, and stood at the top. But this dance, I was very passionate about. And when I completed joined my post-graduation, from then on, I have not, till date, I have not gone back to learning dance, nor teaching dance, nor have I performed really at a stage after that. From 2007, I joined psychiatry, I think 7. So from then on till date, I have not performed dance, not thought of it the way I should have. And at all the annual conferences and group and parties we've danced. But looking at this webinar and listening to everyone, and I'm feeling inspired to, think of unique ways in future to link my, earlier passion of dance and see how we can build something good towards mental health. So we all should work together, I feel, or maybe write a chapter, or maybe even we are going to come out with a book by the Zone on art and culture subcommittee. So we will invite you all. And we'll also be doing one in-person program this year in Mumbai. So all of you have been part of the webinar. If you are interested and you would like to come for the in-person CME in Bombay, then we can invite you all, and we can have an in-person panel discussion. Or so we will invite you all. If you all can come, we'd be happy. And also a book is somewhere planned a year down the line or 6 months down the line. So please, in your mind, collect your thoughts and write some paragraph or a chapter or your own journey. And if we come out with the book, we'd be happy to invite you all. So this is how we can collaborate further for a good future. And we encourage you to, even the audience who's listening, and to think of how you can bring dance and mental health together. And I think that dance makes me very happy. It brings a very unique smile on my face. So we should help everyone get that smile in their life. So with this, I request everyone to smile. We'll take a screenshot. All the speakers, please smile. Yes, and so over to now Dr. Alkesh Patil. If he's there, he can give the formal vote of thanks. Is Dr. Alkesh there?
No, Dr. Darpan, he could not make it, but I shall.
Then I request
Can
you.
I just say something? Just want to thank Darpan for, bringing different types of therapies to the forefront and making, psychiatrists aware of this, because there is so much out there, that we can use not only for ourselves, but for everybody around us. So thank you, Darpan, for doing this. Thank you.
Yeah, and I'm thankful to all my dance teachers, Dr. Veena, I think Dr. Shamak, Mrs. Veena Shamak Dawar, and I also learned from Kunal Tavri and Imran Khan and many more people. So I thank all the teachers who taught me dance also, and my teachers who taught me psychiatry. Yes, so someday we should connect our training and use our diverse brain to give back to society. So over to you, Lisa, and with your thanks. Yeah.
Yes, thank you, Dr. Darpan, first of all, for sharing your perspective and your journey through dance. So thank you for that. And most importantly, would like to thank you for today's opportunity to moderate this session with the topic which is closest to my heart. Thank you for that, Dr. Darpan. I would like to thank our President of West Zone, Dr. Sudhir Bhavi, sir. Would like to thank all our convener, our members who helped get the resources so that we can have a very fruitful webinar today. And also our eminent speakers, Dr. Anita, Dr. Ankit, and Dr. Akshata, for very beautifully leading us through this webinar, and which has been very informative. and motivating, I would say, and also for our eminent psychiatrists who have given the video recording of their performances. So very enlightening and very we thoroughly enjoyed the performances, I would say, and it's a motivation for us to start dancing again. Those who do not. So yes, so thank you everybody, and
Yeah, I just like to add
yes.
a point.
Sure.
As I mentioned, Shamak Dawar, there's a team of diverse teachers who are now at various wonderful levels. But I also learned, and I remember Anisha Dalal, Vijay, Nazim, and some more teachers that who were there for us for our different batches. So I'm also thankful to them because they inspired us very beautifully. Thank you.
Thank you, Dr. Darpan, for sharing that. Thank you, everybody. And thank you,